Hello everyone, welcome to my channel. This is Dr. Meenakshi Gupta. Let's start today's video. So what are the main disorder of the respiratory system? So main disorder of respiratory systems are cough, then we have a bronchial asthma, then we have a COPD, which include that is a chronic obstructive pulmonary disease, which include chronic bronchitis and emphysema. And then we have a acute respiratory distress syndrome. So for the cough, you can check the link in the description box. Today I am going to start another topic of pharmacology, that is a bronchial asthma. So what is the bronchial asthma or what is the asthma? Asthma, it is derived from the Greek word which means to stay awake in order to breathe. To stay awake in order to breathe. That means what are the important symptoms of the bronchial asthma? There are breathlessness. ठीक है, एक ये होती पेशेंट को breathlessness will be there, wheezing will be there, cough will be there, and chest tightness. These are the important symptoms of bronchial asthma. And all these symptoms, they get worsens during the night time. Now coming to what are the different type of bronchial asthma we have. So we have basically two type of asthma, they are there. One is extrinsic, where some outside precipitating factor will be there, and when there is no factor outside is present, that leads to intrinsic asthma, which is mostly seen after the age of 40. So extrinsic is further of two type. We have atopic and non-atopic. So in atopic, there the involvement of the specific stimulus will be there. Like we can have a pollens, we can have a dust, ये वाले हो सकते हैं. So in a non-atopic, non-specific stimulus will be there. It can be chemical irritant. Okay? So here what happens in atopic, the IgE antibodies, they are there which bind to the surface of mast cell. And here also the IgE antibody and IgM antibodies, they are formed, but they are not going to bind on the surface of the mast cell. They remain in a circulation and they form a complex with the antigen. And this complex, antigen antibody complex, in non-atopic, I am telling, in a non-atopic extrinsic bronchial asthma, the antigen and antibody complex, this is antigen, this is antibody complex, it is ingested by neutrophil. They are going to take up this, and what will happen in the neutrophil, they are going to destroy this complex, and what will happen, there is a liberation of the lysosomal enzyme, and this lysosomal enzyme, it is going to damage further the bronchial mucoprotein. So drugs which is going to inhibit this action of the lysosomal enzyme, which is going to inhibit that, like corticosteroids, glucocorticoids, they are going to give a help. Glucocorticoids. Okay, so they are going to relieve the patient. So this is about the non-atopic, and the most common type of asthma, it is atopic extrinsic type of the asthma, that is most common. Another important difference between the extrinsic and intrinsic, extrinsic, it is episodic. It is episodic, and here patient is not prone for status asthmaticus. So here it is a perennial and patient is prone for the status asthmaticus. So what is the status asthmaticus? It is सिवियर एक्यूट एस्थमा, स्टेटस एस्थमेटिकस क्या है आपका? सिवियर एक्यूट एस्थमा, ये इट इज अ सिवियर acute asthma which is life threatening. So another type of asthma, so this is bronchial asthma. So another is we have a cardiac asthma. So what is a cardiac asthma? Cardiac asthma, here also patient will be having a bronchospasm, but that is due to decompensated, that is because of the uncompensated, you can say uncompensated congestive heart failure. Okay. Now, how we are going to treat this bronchial asthma? So, because the topic is bronchial asthma, so before making you understand how the drugs which we use for the treatment of bronchial asthma, so you must know the pathophysiology of the asthma. So, what is the pathophysiology of the bronchial asthma? So what happens? The antigen exposure. Patient ko hai, there is an antigen exposure to the individual. They are going to cause a sensitization. How they are going to cause a sensitization? There will be development of antibodies. Antibodies ban jayenge. I'll draw another color. So antibodies, they are formed. Now, on the further re-exposure to the same antigen, ये वाले फिर से, if the person is again exposed, and this, what happens is there will be production of the antibody, and this antibody is going to bind on the surface of mast cell. Okay, there's a production of the antibodies, and these antibodies will bind on the surface of mast cell. Now, on the further exposure with the same antigens, ये वाले antigen on further exposure, now what they are going to do, they will bind on the surface of this antibodies. Now, with the on the surface of the antibodies, now what will happen? The antigen antibody reaction will happen, and this is going to cause the degranulation of this mast cell. और mast cell के अंदर क्या क्या है? We have a leukotrienes, we have a histamine. So what all the mediators will be released. So it is going to cause the degranulation of the mast cell, and there is release of histamine, serotonin, 5-HT, prostaglandins, then leukotrienes, especially LTC and D, C4 and LTD4, and all these, they are going to cause what? Now this, especially the cystenyl leukotrienes, they are going to bind on the receptor, cystenyl leukotriene receptor, and it is going to cause what? Bronchoconstriction. Now mast cell, they are also going to, ये सिर्फ यही नहीं release करते all this, it is also going to cause the release of other mediator, like the important is like cystenyl leukotrienes, especially now B4, then various cytokines like interleukin 3, interleukin 4, interleukin 13. And now what will happen with this? They are going to cause the recruitment and activation of other inflammatory cell. Okay, they are going to cause the activation of the, they activate other inflammatory cells. कौन से inflammatory cell? In the late phase. In late phase. And this is the early phase. ये क्या है? This is the early phase, and in the late phase they are going to do this. Right? So what inflammatory cell it is going to? Basophil, monocytes, macrophages, eosinophil. Now again, with the activation of these cells, the mediator will be released, like cystenyl leukotrienes, then adenosine, then we have a neurokinin, neuropeptide, neurokinin will be released. Okay? Platelet activating factor, neurokinin A, neuropeptide or a substance P, all these will be released. Now cystenyl and this adenosine, neurokinin, they are going to cause the bronchoconstriction. And also all these three, they are going to cause what? They are going to cause the important thing, like there will be mucus production or mucus secretion will be there, number one. Number two, they are going to produce the inflammation, and they are going to increase the vascular permeability. And all these things, they are going to cause the airway inflammation. Now, apart from this, from the eosinophil, okay, अब eosinophil से this is going to cause the release of eosinophilic cationic protein and eosinophilic major basic protein. And these protein, they are going to cause the damage to the bronchial epithelium. This is damaged. Now, because of the damage bronchial epithelium, the fibers, C fibers and other irritant fibers, they are going to show more stimulus to the irritant stimuli. Like response will be more to this irritant stimuli. So ultimately this is going to lead to causes what? This is the main basis for the airway or bronchial hyper-reactivity. So this is the pathophysiology of the bronchial asthma. Now how we can treat this bronchial asthma? Now we have a bronchospasm. हमारे पास अब क्या क्या है? We have a patient will be having bronchospasm. There is airway inflammation and there is a airway hyperreactivity. So earlier, what you can say 20 years back, we used to think bronchial asthma, it is purely a type 1 hypersensitivity reaction. हम ऐसे सोचते थे. It is purely a type 1 hypersensitivity reaction. What happens in that? This side you can see on the antigen exposure, antibodies they are formed. The antibodies bane which is going to bind on the surface of the mast cell. On the further re-exposure, degranulation will happen and there is a release of histamine and this is going to cause a bronchoconstriction. But currently it is recognized that there is a inflammatory changes that occur in the airway and which is also associated with the hyperreactivity. So no bronchial asthma. What is a bronchial asthma? There is a inflammation. Along with the inflammation, there is a underlying bronchial hyperreactivity. So how we are going to treat? We are going to, if you know this pathophysiology, how we are going to treat? We can treat it by acting at all these various steps. कौन से step? Like patient will have a, क्या है patient को? Bronchoconstriction. So we can give a number one. यहाँ पे हम patient को क्या दे सकते हैं? Bronchodilators. ठीक है? Then another is this cystenyl receptor. Cystenyl receptor, leukotriene receptor antagonist. And cystenyl leukotriene C and 4, from where it is formed? It is present here. All these. So they are formed here. So we can inhibit the formation of LT. LT formation, we can inhibit that. So this is a number one drug. Number two is cystenyl leukotriene receptor antagonist and this is number three, or you can say leukotriene modulator. Under the leukotriene modulator, these drugs, they are either going to inhibit the formation of leukotrienes or they are going to inhibit them to work on the receptor. This is a number two. Number three is now this degranulation of the mast cell. So we can give the mast cell stabilizer. So this is a number three. Number 4, how all these happens, this antigen antibody reaction. Okay, so we can give monoclonal antibodies. Like omalizumab. So monoclonal antibodies, what they are going to do, they are going to inhibit this binding of this antigen on the surface of the antibody. They are going to inhibit this antibodies. Then another group of drug is, we can give a anti-inflammatory, because inflammation that is there. So we can give the anti-inflammatory drug. So you can see in the next slide. So a little bit, I'll show you a clearer picture. So this is the pathogenesis I have told. So what we can give bronchodilators here. यहाँ पे आप bronchodilator दे सकते हो patient को. We can give a bronchodilator. We can give the drug which inhibit the degranulation. We can give the cysteine receptor antagonist. We can give the drug which is going to inhibit the formation of leukotrienes like steroids. And we can inhibit the interaction of these antigen antibody. And we can give the anti-inflammatory. You can see in the next slides various drug which we are going to. So this is a bronchodilators. We have anti-inflammatory drug, leukotriene modulator, mast cell stabilizer, and monoclonal anti-IgE antibody. Okay. So in the next section, I will be taking the drugs for the bronchial asthma.